My name is Renee Rathbun, and I'm a nurse anesthetist, and I'm working in Danbury, Connecticut. We actually, as of anesthesia providers, we had to move all of our anesthesia machines into the ICU 2 months ago. And initially, we were ventilating all of the COVID positive patients. And over the past 4 to 6 weeks, we've managed to close 2 of the ICUs, move all of the anesthesia machines back to the operating room, and transition patients to normal ventilators. I think the whole experience was just very eye-opening. I think most healthcare providers were put into a zone that they've never anticipated in their entire career. And everyone's roles kind of expanded in the time of need. Nurses, respiratory therapists, physicians, everyone kind of learned to extend their initial role, collaborate together, and really, without having families with these patients, we became the people that were at the bedside for one another. And the days were long, 24-hour coverage of ICU with nurses and anesthetists, changing every 12 hours. Without one another's support, I don't think people would have made it through the past 8 weeks without it. Initially, until they figured out the best way to communicate with families, a lot of people just thought, okay, there's not going to be any communication. And nurses started using FaceTime with families. They were using Zoom sessions, so families could be up and running in the patient's room 24 hours a day. And I think that it was just an overall comfort for family members to know that they had loved ones watching over them while they're being cared for. I think we were facing the unknown when we started this journey together, and we've come up with ways to make sure that we're supported, emotionally, that we're supporting each other. I think it takes most frontline providers a little time to really think about what they've encountered on the last 12 hours of their shift. And it may not be, moment, it may be the days that follow, that it's really helped strengthen the department, and really people are turning to one another when they've had a bad situation or have seen something that was pretty upsetting to them.